Over the past couple of weeks, we have been working on a community health assessment project for Wake County, North Carolina. Our aim for this project was to examine population-based health needs for a diverse population to include available health care services within Wake County. Our future goal will be to assist in the health maintenance and promotion of our identified population through education and support. Our identified topic includes improving dental care for the pediatric Hispanic population in Wake County, North Carolina. Our examination of the community included a windshield assessment, 2 interviews from professionals with knowledge of healthcare disparities in Wake County, and a secondary analysis. The windshield survey is a survey of the community including resources such as housing, transportation, and healthcare services. The community of Wake County consists of several major towns and cities including Raleigh, Cary, Apex, Holly Springs, Garner, and Buque-Varina. Housing opportunities include single-family homes, duplexes, apartments, townhomes, as well as mobile home communities. The primary mode of transportation is by personal car. However, Wake County also offers public transportation in the form of a bus. There are also carpool services and services such as Uber and personal taxis. Wake County is also known for its vast array of parks and open spaces. Every town or city in Wake County has at least one. The Parks and Recreation of Wake County manages these areas, and they are free for residents. There is also a wide array of grocery stores, retail stores, and shopping centers. On top of that, Wake County also offers a farmers market that is open year-round on the weekends. There's also a large selection of religious organizations in Wake County. The Hispanic population is predominantly Catholic, and Wake County offers numerous avenues for people of the Catholic religion to congregate. Wake County also has a great public school system with year-round and traditional schedules. There are also a selection of private schools. Wake County is also home to the University of North Carolina State and Wake Technical Community College. There are also numerous job opportunities in Wake County, including opportunities for continuing education for job placement and career resource companies to assist in the job finding process. Wake County also offers a large selection of pediatricians that accept both Medicaid and self-pay. Wake County is also home to 2 major dental schools, and as such has a variety of dentists who specialize in pediatric patients. Uninsured pediatric patients are also offered care on a sliding scale basis. There is also a public safety department in Wake County. Such services include EMS, fire, and police. If a person is in a state of emergency, all they have to do is pick up their phone and call 911 and help will arrive. To gather expert advice on challenges facing the Hispanic pediatric population, we interviewed 2 experts in the field. Justin Brinkley is a sales executive for Blue Cross and Blue Shield in North Carolina. According to Justin, coverage in the United States is regulated by each individual state. Each state has their own Department of Insurance, which dictates the rules and requirements for coverage in that state. He says that things get even more complicated when you are looking at coverage and access outside of the United States. Specifically in South America, the South American system looks dramatically different than what we have here in the USA. Corruption exists in these countries, which leads them to an all-cash or sometimes barter system for their coverage. This is much different from what we have in the States. Our system works much differently. Because of the culture difference, a lot of Hispanics do not typically trust our system. By demographic, most Hispanics don't even have bank accounts because they don't trust the government and fear the opportunity for corruption. Because of this, it is difficult to get very basic information for them, which is the foundation for coverage. Examples include a social security number, a bank account information, date of birth, dependent information, etc. Because of this lack of trust, this leads them to the path of least resistance for care, the ER, which is consequently the most expensive place for services. Kevin Fortner is a dental student at UNC Chapel Hill. Kevin Fortner says that the most common problem with dental care and the Hispanic pediatric population is access to care. These children and their parents often have a very low income, so any extra money in the family, if there is any extra money, does not get spent on their oral health. The dental school at UNC Chapel Hill offers dental care at a reduced rate at the UNC Undergraduate Pediatric Dental Student Clinic. This is a resource for low-income families, but often they are not aware of this service. Language barriers are also a huge problem. Many times, the parents do not understand what they are being told about their kids, but they are so embarrassed they act like they understand when they actually don't. Lack of education is also a huge problem. Many times, they are not aware of proper brushing techniques or the importance of using fluoride mouthwash, so Hispanic children have a higher rate of tooth decay than children of other nationalities. Education and having student clinics available are great ways to improve oral health in low-income individuals. We also conducted a secondary analysis for Wake County. We found that the Hispanic population is quite large in North Carolina, and 1 out of 4 Hispanic people live in either Wake or Cumberland County. The total population of Wake County reached 1 million in 2014 and is expected to double by the year 2054. Each day, 40 new immigrants move to North Carolina. Hispanic is the third largest ethnicity, and approximately 22% of the population speak another language. Some of the needs that the Hispanic community have identified for themselves include access to care, language barriers, and health literacy. Sometimes a Hispanic will say they understand what a physician is saying, but they are so embarrassed and don't want to admit that they don't understand. Through our research, we have identified 4 major priorities for Wake County: health insurance coverage, lack of transportation, access to care, and mental health and substance abuse treatment. In our review of data, we noticed that Wake County has some positive and some negatives. Positives include Wake County is one of the healthiest counties in North Carolina. We've been ranked the best place to live for several years, and we are also the community with the highest well-being in North Carolina. Some of our negatives include the lack of transportation, our need to improve our access to care, and our need for more community clinics. In order to determine our community diagnosis, we evaluated strengths and weaknesses of our patient population. Some of the strengths include the fact that Hispanic children know 2 different languages, so that gives them the ability to communicate with a more diverse population. A lot of Hispanic children come from 2-parent households. Latinos believe in strong family ties, and therefore, parents usually stay together. Social ties among Hispanic families are also very strong, and that is a positive. It is a strength. Some of the weaknesses are the fact that a lot of Hispanics have low-income families. English is their second language, and they have a poor health literacy. The top health issue among Hispanic pediatric patients is access to dental care in southern Wake County. In fact, this is the third health priority overall in Wake County. It is a huge problem. Our community diagnosis is knowledge deficit related to proper dental care, as evidenced by higher rate of tooth decay in Hispanic children compared to non-Hispanic children. Some of our interventions include a primary intervention. We believe that these Hispanic children and families should be educated about proper brushing techniques, flossing, utilizing fluoride rinses, and education about the importance of biannual visits and the availability of clinics in Wake County. We don't only believe that these patients should be educated about the proper way to brush and take care of their teeth, but they need to be taught how to get these services that are available to them, and they need to be taught where these services are at. A secondary intervention is regular dental exams. We need to connect patients to resources that will allow them to get regular dental exams. A tertiary is to actually get dental care. We need to connect these patients to dentists that can help them get the fillings and replacement of teeth and the repair work that they need to have done on their teeth. In conclusion, despite the fact that Wake County is one of the best places to live in the nation, we have great schools, great health care, great quality of life. We also have some problems in our Hispanic community. Through the completion of this assignment, we have learned how to examine population-based health information and to identify priority needs in our community. The skills learned in this assignment will be important to the future of our nursing practice as nurses seek to improve the communities that they live in. The nursing value of altruism requires that nurses investigate their communities and to seek ways to improve healthcare for those in need. This assignment has taught us how to do that. And these are the references that we have used. This completes our community health assessment for Wake County, North Carolina. Thank you.